Thank you for joining us to this exciting session. You will learn a lot today, I'm sure, new things, exciting content. The mission of Thermo Fisher Scientific is to enable our customer to make the world healthier, cleaner, and safer. So definitely today we're going to address the first part of the mission, which is to make the world healthier. My name is Alain Rico. As you can hear, I'm French, so bear with my accent. I hope it's going to be okay. And I'm in charge of the market development for the reproductive health for Europe, Middle East, and Africa. I'm going to briefly introduce the global vision from Thermo Fisher Scientific when it comes to reproductive health, and then I will introduce the speakers that will have the actual scientific content for you today. Oops, next slide. I got it. So as I mentioned, we really want to help people to cure a lot of diseases or make the world healthier, and we have quite a few innovative solutions to achieve this goal. So we're going to briefly go through the comprehensive portfolio, our menu of application, if you may, and I also wanted to remind you that not only we do have good products, ready-to-use solutions, or product for you to develop your own solution, as you will see later today, but we also have a lot of people in the back to help you with this product whenever something is happening, or just to make sure that it will work in an optimal way. For instance, we have a 24/5 support globally, like follow the sun model. So wherever you are, you can have someone by email or even over the phone to discuss some applications like the pre-implantation genetic testing solution we have. So that's unique, and we are really want to make sure that we are the trusted partner for your applications. Before having a baby, as I mentioned, maybe you will have to go for a carrier screening, or maybe you know that one of you is carrying a mutation and you want to know exactly which one, and we have solutions for that, as I said. So during carrier screening, you would typically look at two kinds of variants. The first kind would be more a sequence variant, can be single nucleotide variants or more than one base variants. Typically done right now by Sanger sequencing for confirmation, or by genotyping, or also next generation sequencing. Typical diseases would be thalassemia, sickle cell disease, or also cystic fibrosis. There's a majority of sequence variants in these diseases. The other kind of variant would be more a structural variant, where you would look using techniques like MLPA or real-time PCR, but this can really be expensive if you need to test a lot in parallel. Talking about structural variant detection, we are talking alpha thalassemia or Duchenne, for instance. So different type of variants to analyze, different platforms, increase of time, of cost, etc. So ideally, you would like to analyze everything at once on a single platform and a single workflow. And that's what we offer to you with the Carrier Scan 1S assay. Again, it's an assay. It's not only the microarray, it's the reagent, the software also, and the reporting tool. Very, very powerful system with a lot of variants, more than 6,000 variants analyzed for more than 600 diseases. A lot of them have been performance verified using actual samples provided by some of our early access customers. So that's also very important when you go in the clinic. We include variants for Duchenne, for SMA, and for the thalassemias. That's also important for you. You don't have to run an additional test, typically. And it's very high throughput. And part of the 6,000 variants I was mentioning, most of them are pan-ethnic. So you don't have to worry for your own very specific population. Maybe typically every variant would be included in that test. You can learn more about carrier scan at thermofisher.com/carrier scan. And also, of course, at our booth, we have some of my colleagues that know much more than me about it. Now, into the topic for today, pre-implantation genetic testing in general. And I say in general because, of course, I would say everything started with PGTM, called PGD at that time, and PGTA, called PGS at that time. I'm not going to go into the reason why people would go for testing aneuploidy on embryos. We, I think, all know now that it really helps after a certain age because most of the eggs and the embryo would be aneuploid otherwise when implanted, thus leading to either a miscarriage or no pregnancy.